Hi, I'm Dr. Andrew Koenigsberg of Gallery 57 Dental. Welcome to Floss Talk, where we discuss oral and dental health issues with healthcare experts. Today, we have Sharon Richter, a registered dietitian. Welcome, Sharon.
Thank you.
Sharon, can you share with us some of the dietary and nutritional aspects related to dental health?
So there's a variety of things that I've seen over time. Some is people don't know the different food groups, and we have the obvious ones like candy that might affect our teeth, but there's some hidden ones and different types of carbohydrates, acid that are going to affect our teeth. Those people that are vegetarian and strict vegans are missing some nutrients in the intake of what they're having, and this can affect your overall health as well as your dental health. The acidity of foods we have to think about, and also we need to think about the frequency we're eating and does that affect our health.
Sharon, we know that frequency is a big risk factor in dental disease. Can you discuss some tips or suggestions you have for people to minimize these problems?
Sure, absolutely. So first, many of us hear all the time to maintain healthy weight and for weight loss, you should eat frequently throughout the day. So this is going to be very controversial to dental health. Because what happens is if we're eating throughout the day, we're constantly putting things in our mouth that are carbohydrates and that are going to break down to sugar and then become acid, which is not going to help our teeth at all. So if we think about a typical day, someone first wakes up and they might grab a piece of fruit or have a handful of cereal, then they get to work and they have breakfast, then maybe an hour later they have a coffee, which might have milk in it, it's going to turn to sugar, or maybe they add sugar to it, then they're going to have a snack, then they're going to have lunch, another snack, and it goes on throughout their day. And most of these things have some sort of a carbohydrate in them. They're going to break down to sugar, turn to acid, and they're going to be detrimental to your dental health. So what we have to think about is how can we reduce the amount of carbohydrates that we're eating throughout the day. And what I've learned is that it takes about 2 hours for the mouth to neutralize, and nobody's giving their mouth a break for 2 hours until we go to sleep.
Right. Yeah, and I think that along with that, something that people don't realize is even the tiniest amount of sugar, one Tic Tac, which people may think is insignificant because it has very few calories, that's enough to turn the oral environment acidic for a couple of hours.
Mm-hmm. And also drinks, I think, are a big thing. You know, people
Absolutely.
are like, I had coffee, even if they have it, you know, I put skim milk in it. They think that it has very low calories, and they think that they might associate the calories to maybe not being detrimental, but that milk has sugar in it.
Exactly. Sharon, you mentioned acidity, and that's a huge issue because acid erodes teeth, and we're living for a long time, so our teeth are subject to the acid for a long time. What can you tell us about foods that may cause acidity or leave our oral environment acidic, and what we can do to reduce that?
Sure. So there's some foods that we all know that are acidic. Lemons, limes, oranges, we know that they are. And what I've seen so many people think is the minute I eat them, let me go brush my teeth and try to remove it, which is absolutely the worst thing they can do because they're like brushing the acid into their teeth, which is not going to help it. You're not removing it at all. So really, those people have to wait at least the 2 hours to make sure their saliva is neutralizing their mouth. But we also have to think about there are other foods that are acidic. Coffee's going to be acidic, wine's going to be acidic, tomatoes are acidic. So a lot of these things are in our diet. We want to try to, reduce, or when we're having them, really think about giving your mouth that 2 hours to neutralize.
Sharon, when people exercise, they tend to have sports drinks, which can be both sugary and acidic, and they may be snacking more. What suggestions can you give for our active patients?
So there's a few things. A lot of these sports drinks have sugar, but they also are acidic. They're lemon lime flavor, and we know acid is not good for our teeth. People want to go brush their teeth to try to remove it. That is the worst thing they could do. You want to be able to wait that 2 hours to let your mouth neutralize before having it. Then when they want to think of a snack, what your body needs is protein. It's going to make you feel full, satiated, and it's also going to feed your muscles, which you just worked. So something like nuts is a terrific thing to have after, or nut butters, even just putting a spoon of peanut butter on celery. You're not adding carbohydrates that are going to turn to sugar. You're just giving your body protein and healthy fats that are going to be satisfying.
Sharon, what are some of the dietary and nutritional concerns for our vegetarian patients?
Sure. So one is, it depends on the age. So young people that are vegetarians, that's where it's really risky, especially if they're vegans and they're really having no dairy in their diet and they're having no calcium, because that's really the significant time for overall health, for your bone health, for your teeth health, and everything to make sure you're having the dairy. So if you're not having any animal products, dark green vegetables and broccoli are going to be a source of calcium, and some things are fortified, like they fortify orange juice with calcium. As we get older, it's not going to affect your dental health. It will affect your bone health, the calcium, but not as much our dental health. So that's not as much of a key thing. But there are some, for people that are really strict vegans, there are some amino acids, which is part of protein found in fish, meat, and chicken, such as L-arginine, which is one of the amino acids, that it's supposed to be helpful for gum health. So you want to just make sure that you're getting a supplement, a multivitamin that's going to contain all the essential amino acids in it for your overall health. And also just thinking about many times when people are vegetarians, their diet is very heavy in carbohydrates. So they're going to have a lot of that food that's going to break down to sugar in their diet. So they really need to be careful about having those snacks and things that aren't going to be heavy in carbohydrates.
Thanks. That's very useful information. Sharon, thank you so much for joining me on Floss Talk. It was very interesting and informative to hear how much sugar and acid is hidden in our diet, and I really appreciate the suggestions you've given our patients. Please check out our other episodes on Floss Talk.